If you're thinking about participating in the TF-CBT training, there are a few things to think about. You want to make sure that you're working at an agency where you will have referrals, so children who have experienced trauma and have trauma symptoms, and that there's a way to find those kids and assess who needs TF-CBT. We also want to make sure that the clinicians are able to participate in this learning collaborative method so that they can attend trainings, attend phone calls, and that they're open to getting support and getting consultation. And we will support them in figuring out how to make this manualized type treatment really creative, fun, where they can add their own skills. What we expect TF-CBT to look like is usually about an hour per week. That would be maybe about 30 minutes with a child, 30 minutes with a caregiver. Sometimes it might be 20 minutes with a child, 40 minutes with a caregiver, etc. But we know that kids do best when they're seen on a weekly basis, when caregivers are seen on a weekly basis. So one consideration when you're thinking about implementing TF-CBT at your agency is making sure that clinicians have time to see kids on a weekly basis. We know clinicians are really busy these days.
In my experience working with TF-CBT, it is essential that organizations really have a good, effective screening and assessment process in the very beginning. The screening process, more importantly, will help you really identify clients who are experiencing trauma and who could benefit from TF-CBT. Organizations should really put a lot of effort towards making that a process very streamlined and seamless for the clinicians and the clients coming into their agencies. Other advice that I would give clinicians that want to implement this model would be just to be creative. TF-CBT is a very component-driven model, but that doesn't mean that you shouldn't tailor the model towards the clients that you're working with. That creativity goes a long way in TF-CBT. It will help you as the clinician, it will help the client feel more engaged, and it'll make it fun. And that's what we essentially really want to do. And so I would say that really thinking about the clinicians who are not only competent in the work that we're doing, but also just brave and willing to share the work that they're doing. And they will reap the benefits from being able to do that, for sure.